Welcome again, everyone. So today we'll be learning about Perthes disease. Okay, so Perthes disease is actually idiopathic osteonecrosis, which is spontaneous in children. Okay, so osteochondritis of the femoral epiphysis. It's basically osteochondritis of femoral epiphysis. Okay, so what happens is basically this is your shaft, this is your neck, and this is your head. Okay, neck, shaft, head, and shaft. Initial days, what used to be there is like when you are less than 4 years, the artery supply is from your foveolar artery, like this, during less than 4 years. When you increase in age, like more than 10 years, the artery supply is metaphyseal. During this transition of 4 to 10 years, there is actually a transitional phase from foveolar to the metaphyseal phase. Okay, this is known as the bridging phase. This is known as a bridging phase. In this bridging phase, if there occurs any injury or any trauma or any unknown case, okay, or any unknown case, what happens is they can lead to ANF, that is avascular necrosis of the femur. And what of femur? The epiphysis of femur. Okay, during 4 to 10 years of age. So it's important to not have any kind of trauma during that age. What are the certain risk factors or the most common causes? Risk factors or the most common causes. So one is idiopathic. The most common association is it is protein S deficiency. Males are much more commonly affected than females. 10 to 12% is bilateral, and less than 6 years they have a good prognosis, but someone who is more than 6 years they have a bad prognosis. Okay, so the main aim, the major motto behind of this Perthes disease is we want to, please write it down, we want to keep the head actually not necrosed from 4 to 10 years. If there's any kind of trauma or if there's any risk factors for Perthes, at the age of 4 to 10 years of age, I just want to stabilize that head such a way that I don't need to go for a head replacement surgery. Okay, for that I get a cast which is known as a Petri cast or a broomstick cast, which I use it like this. Okay, so this is a Petri cast or a broomstick cast which you can use, and this cast, if it's kept in the posture of abduction, okay, because here there'll be difficulty in abduction and internal rotation, so you keep this cast in abduction and internal rotation itself. Okay, so that the head part will not be damaged. Okay, you have to give, you should not give any kind of weight to the limb. And if you go on an x-ray, what will you find? So this is your bone. Okay, so what you will find in x-ray is you will see the metaphyseal head is actually a flattening of the head, which is actually known as a mushroom shaped flattening, mushroom shaped femoral head flattening. And what you can see is you can see sclerotic line in the femoral neck, and this is known as sagging rope sign. And at that area you can see a metaphyseal cyst. So this is actually known as gags, and this carry a bad prognosis. Okay, gags, metaphyseal cyst. So sustain the head until and unless full vascularization is attained. If not, you have to go for surgery at the end of the day. Okay, this completes our video on uh, Perthes disease. Thank you.